So, hi, everybody. I am so honored to be here today and to be talking to someone that is such a benefit to our lupus community. Today, we're going to be talking about lupus nephritis. And this is something that is definitely near and dear to my heart because when I was diagnosed with lupus, this was something that I immediately received a diagnosis with and have had such a impactful journey due to lupus. I was diagnosed formally in 2000, so this is going on my 21st year living with lupus. And with that diagnosis, I also had kidney issues and pretty severely, so severe that it caused me to need to do dialysis, which I did for 9 years. And that was followed by a successful kidney transplant, which I've been celebrating because this May, which is also special, I am in my 13th year with this transplant and in remission with lupus. So welcome, Dr. Brad Rovin. I'm so glad to have a conversation with you. And we know that you are definitely a pro when it comes to lupus nephritis.
Thank you, and thanks for having me here.
So we have some questions for you, and I'm sure our community is probably wondering the same things that I am wondering. And so the first one is, can you tell me what exactly is lupus nephritis?
Yeah, so lupus can affect a lot of organs, as you and all of your colleagues and friends and our other patients know, and especially the kidney. The kidney is the most commonly affected organ in really bad lupus.
Mhm.
And lupus nephritis is a specific condition where the autoantibodies or the antibodies against your own body proteins accumulate in the kidney. And then they cause inflammation in the glomeruli. The glomeruli are the filtering units of the kidney, that's what they're called. And this inflammation then causes the glomeruli to leak protein and to leak blood into the urine, and that's what we see. But more importantly, this is an indication that the kidney is inflamed, and if that
Mhm.
isn't cooled off, if you will, with medication, the inflammation will go on to damage the kidney, and this damage is not repairable. And this could
Mhm.
actually go on to what you experienced, which
Yeah.
is end-stage kidney disease requiring a transplant or dialysis. So obviously that's the most important thing that we try to prevent when patients have lupus nephritis.
Yes, proteinuria was something that I heard right away that I had protein leakage. And so I didn't realize at the time that that was an indicator of that. But
Yeah.
could you tell me a little bit about approximately how many people with lupus will have lupus nephritis? We also like to call it LN for short, or kidney complications. I'm
Yeah.
sure everybody hasn't had an experience like me. I think I'm a kind of scary story, but give
Well,
a bit of information.
you're actually, yes, it's a scary story, but there's a lot of people like you, unfortunately.
Okay.
So lupus nephritis, if you read the sort of epidemiology studies and the textbooks, it affects about 40% of people with lupus overall. Now,
Okay.
I think though that we really need to explain a little bit more about that because it is not an equal opportunity effector of the kidney. So
Mm,
people who are African American, for example, or
mhm,
African ancestry, tend to have more frequent lupus nephritis than, for example, white uh, people. And patients who are Hispanic also tend to have more lupus nephritis. So it can affect up to 60 to 70% of people, and then if you bring children into the equation, a lot of kids who have lupus nephritis. So it's a little bit higher in pediatric presentation than it is in an adult presentation. So bottom
okay.
line is a lot of people with lupus will eventually have lupus nephritis. Not everybody presents at the time of diagnosis like you, but most
Mhm.
of the time lupus nephritis is found within the first 5 years of the
Yeah.
diagnosis of lupus.
Okay. I'm glad you shared that about kids. I had heard that about kids, and I saw some, and I've heard some statistics about men. Is it true that men often are more common than women to have lupus nephritis?
No, I really don't think so. You know, it's hard to do good epidemiology studies,
Okay.
uh, but you know, I think that that can. It's hard to do good studies because there's so few men, right? So it's
Okay.
really about 90% women and about
Mm-hmm.
10% men. Um, but we have plenty of men who do have lupus nephritis, and I think you know, sort of the idea is men with lupus tend to have worse lupus nephritis or
Okay.
worse lupus, and then they often have lupus nephritis. So
Okay.
I think
I
that's
got you.
where that comes from.
Okay, that makes sense. So I know for me, it was definitely a life-changing experience having to do dialysis, not really being able to work full time because of the demand of the treatment. What other impacts would you like to share that often occur when a person has lupus nephritis? What are some complications? Um,
So yeah, so I think you know, other than you know, the extreme complication is if the kidney just isn't working, and then you have to have kidney replacement therapy. But you know, that's sort of the worst.
okay.
What really so a lot of times people don't know that they have lupus nephritis with their lupus
Mm-hmm.
because they are asymptomatic. They have protein in their urine and they have
Mm-hmm.
blood in their urine, but their kidney function is okay, and they're not excreting a sufficient amount of protein to have a real impact on their body. Now, once you get beyond a certain level of protein in the urine, you can start to swell. And so that's a pretty
Okay.
common finding that patients will note that they've started to accumulate fluid. That indicates that the protein levels are usually over 3.5 grams a day. Most people who don't have any kidney disease secrete about 200 milligrams of protein, so zero point 0.2 grams per day. That's normal. We all do that.
Okay.
Patients with lupus, it can increase quite dramatically. And if it gets really high, like in the grams level, then you can get swelling. So that's one
Okay.
thing. The other thing is you usually don't see blood in your urine, okay,
Oh,
because
yeah.
it's
Okay.
usually under the microscope. But people with lupus kidney disease can also have hypertension, so that can be a problem. And one of the things that's often seen with lupus, as you probably know, is fatigue. And I
Yeah.
also see a lot of fatigue with kidney disease. So these are the sorts of things that a patient might notice, and then tell their doctor, and then the doctor should say, "Hey, I better check your kidneys."
Yeah, I could definitely relate to those. I had both swelling, really substantial swelling, as well as fatigue. The fatigue was really almost unbearable. It was hard to really function with that. So that makes a lot of sense. I do want to touch on, I know there's classes of kidney disease.
Mhm.
I wanted you to kind of touch on that. Based on the class, when should you really be concerned about lupus affecting your kidney? I know there's different.
Yeah, so what Wendy's talking about for those who are maybe a little bit new to this is that when we do detect there's problems with the kidney, we most often will do a kidney biopsy, which I'm sure Wendy has had.
Yeah.
And a kidney biopsy means we take a little piece of tissue out of the kidney and look at it under the microscope to see what's going on. Most of the time, we will classify lupus nephritis through what's called the Renal Pathology Association and the International Society of Nephrology classification. So it's a lot of words, but anyway, it's a classification system that has different classes of lupus. And the classes of lupus are a description of what's going on and the damage that we see inside the kidney. So
Mm,
there's 6 classes of lupus nephritis. We virtually never see class 1 because those patients have very little indication of kidney disease, so we wouldn't necessarily see them to do a biopsy. patients with class 2 lupus nephritis is also pretty minor involvement, but patients might have blood and protein in their urine, not excessive levels. Their kidney function is generally fine. And if we do a biopsy, we see damage confined to just a certain portion of the filtering unit of the kidney. Classes 3 and 4 are called proliferative lupus nephritis, and these are pretty inflammatory uh, types of kidney injury. And these are the ones, especially class 4, that can move pretty quickly, can damage a lot of the kidney all at once, and really lead to a significant impairment of kidney function right away. And then class 5 lupus nephritis is a little bit different in that it's mostly protein in the urine as opposed to a lot of inflammatory changes. Most of these patients initially start out with normal kidney function, but untreated, this will deteriorate over time. But these folks often have a lot of protein in their urine, and they're often the ones that will present with swelling. And then
Okay.
class 6 is the class we try to avoid. Class 6 lupus nephritis is basically non-active inflammatory disease anymore, but the kidney is near end stage, so it's all
Mm.
scarred up. So that's the one that we don't want to see. Of course, we don't want to
Yeah.
see any of them.
Right.
We don't want anything to progress to class 6.
Right. Thank you so much for that explanation. I know that's a common concern of people when they hear what class they're in. Now, I know there's been some advancements. We've had some exciting announcements this past year, and for me as a lupus nephritis patient and warrior, I was so thrilled to hear this. But can you share some of the key advancements
Yeah.
been made in the last decade in perspective of lupus nephritis research?
So yeah, I think we this has been one of the best parts of my career in working with patients with lupus, and then getting involved with clinical trial work.
Mm.
So for a long time, we didn't really have any treatments specifically for lupus kidney disease, and as you probably know, when you got your kidney disease, the drugs we used were pretty strong and
Yeah,
had a
that's a
lot of
good word.
yeah, it had a lot of side effects,
Yeah.
and we borrow a lot of our medications from the cancer domain, because most of
Mm.
those drugs, or many of those drugs, are immunosuppressive drugs. We don't use
Yeah.
them in the doses they do, but we do try to suppress the immune system. So anyway, fast forward to now, and over the last decade, through a lot of diligent work by a lot of scientists all over the world, and let me say, even more diligent work by the patients who participated in the clinical trials, we have 2 drugs approved by the FDA. And these are voclosporin, which you may not have
Mhm.
heard about before, but voclosporin is a drug called a calcineurin inhibitor, and it's in the family of drugs that we use in kidney transplantation and solid
Mm.
organ transplantation. This is a different variety, a different formulation of a calcineurin inhibitor that's been approved for lupus. So that's very exciting. And then the second drug you have heard of probably is belimumab, because this was approved many years ago for non-kidney lupus, but now has shown benefit in lupus kidney disease. And I think what we had witnessed prior to these approvals, which occurred in late 2020 and early 2021, was a number of clinical trials with very promising medications that didn't sort of reach the bar. And I think what
Oh.
we learned from those clinical trials is how to actually put a trial together in lupus nephritis. So there was a big learning curve
Okay.
for all of us in clinical investigation. And I think from the early, I hate to call them failures because we learn from everything we do, but
Mhm.
from the early ones that did not result in a drug being approved, we learned a lot of things about how to run a clinical trial, how to look at medications appropriately, and look at endpoints. And so now we have the exciting opportunity two new drugs. We're just
Mhm.
learning how to use these drugs. And then on top of that, we now know as a community, and I think this is possibly the most important thing to get out to folks with lupus, we now know as a community how to do these trials. And
Wow.
I think that is going to make a huge difference going down the road with a lot of the newer drugs. And I just
Okay.
want to mention for the folks on this video, um, you know, one of the biggest goals is to develop drugs that are more specific and have far fewer side effects. And I think most of the patients would appreciate that, knowing the side effects they've had with their current lupus medications. So I think that this progress and the two approvals suggest to me that going forward, we're going to see more drugs come on board for lupus and lupus
Okay.
nephritis, and that these drugs will be increasingly better tolerated and
Mm.
also will target just parts of the immune system that are important for the person's lupus, and not hopefully inhibit the whole immune system. And I'm
Oh,
sure,
wow.
Wendy, you were told that when you started out with treatment that you were going to be really immunosuppressed and you were subject
Yes.
to infections and this and that. And that's always the
Mhm.
case with an immunosuppressive drug, but we hope we can reduce the incidence of infection because that is the scariest part to me with most of
Mhm.
these medications.
That sounds so exciting. I just feel so proud, first of all, of the work and the perseverance of the scientific community. And I definitely want to applaud and celebrate the patients that
Yeah.
have participated in clinical trials. And I have to say, I know in the Black community, this is something that has been a challenge and a fear of many people. So I'm glad that the clinical trial process is definitely being improved, and that I know the patient is at the center and they have the decisions to go through it, and they're protected and everything. So
Yeah.
thank you to all of you that have participated, and I hope those listening are encouraged to participate in the future trials so that we can have the development of drugs just like this, that are more tolerable and better equipped to focus on specific areas. And I'm so
Hmm.
excited to hear that. Are there any other research projects or treatments that are on the horizon that you are really excited about, or that look very promising for our community?
Yeah, I'll mention a few, and we're involved in some of these. So this, full disclosure, we're doing a lot of research in lupus and lupus nephritis. So there's several things that are on the horizon. One of the important things we think is to develop biomarkers. You might have heard this term
Yeah,
before.
I
We're
have.
trying to develop biomarkers that tell us, so we don't want to do a kidney biopsy every week. I think most
Hmm.
patients would not like that, obviously.
No.
But the kidney, we want to be able to understand what's happening inside the kidney as we treat the patient. So we know, are you getting better? Are you getting worse? Is this effective, not effective? So my lab has been involved in looking at biomarkers in the urine, for example, which is easy
Okay.
because I don't think anyone minds giving a urine sample every once in a while.
I
We're
want to
looking,
pause you really quick,
yeah,
Brad. Can you explain what a biomarker is, just
yeah,
to make sure
okay,
people
sure.
know?
So biomarkers are things, generally proteins, but
Okay.
they don't have to be proteins, that are used to give us an idea of what's happening when we can't measure what's happening directly.
Okay.
So they're sort of substitute markers of what's going on. So if we say, for example, we want to know what the kidney injury looks like, well,
Hmm.
the gold standard of that is doing a kidney biopsy and looking directly at it. Okay.
Okay.
In lieu of that, we and others, lots of other people have said, well, what if we look in the urine for proteins, for example, that come out in the urine that might actually provide us the same information as a kidney biopsy or very similar
Mm.
information without having to do the actual biopsy part. Okay,
Okay,
so this
so we
is
don't have to
C9.
be invaded all the time. Okay.
Exactly. So a biomarker is sort of something that can give us a readout. The other is it's like a surrogate to some extent. But anyway, that's the idea. And so what
Okay.
we want to do is look for biomarkers of histology. And I will tell you that I think we're starting to find some that actually look pretty good. This has
Oh,
been
okay.
something I've been working on for a long time, as have many other
Mm-hmm.
people, and we now have some that look really good. They have to be validated in clinical studies, but I think that's going to be coming down the pike, and that's exciting for people.
Okay.
We're also really involved in many of the folks in the lupus community are involved in genetic studies to try and
Mm.
understand who with lupus is actually predisposed to developing lupus nephritis.
Mm-hmm.
If we can, understand which patients might develop lupus nephritis, it may actually be possible to follow those patients closely, maybe even with some of our biomarkers that might indicate early kidney disease, and intervene before the kidney disease gets bad enough to have a presentation like what you experienced in your life. So in other
Yeah,
words,
that's
treat
good.
early, treat when the disease is not so severe, and maybe we can, get that under control very quickly with minimum amount of damage to the kidney and minimum amount of inconvenience to the patient. So that's really important. And then the NIH has been directing a study. It's called the AMP study, AMP, and
Mm.
this has been looking at bringing advanced technology to understand kidney disease in patients with lupus. That's one of the big projects or big arms of the AMP study. And so what I mean is we've had for a long time, let's just say the kidney biopsy. We look under the microscope, we stain the tissue, we know what we're looking at. Now we're looking into the tissue itself. What are the molecular mechanisms that are causing injury? And can those molecular mechanisms that we understand eventually be harnessed to treat the patient differently or more specifically? And this gives us the opportunity, I think, this is the last thing I'll say that I think is really exciting, is how they say every patient is different,
Mm-hmm.
patient's lupus is different. That's true.
Yeah.
So right now, we used to have 2 drugs. Now we have 4 drugs we can treat lupus nephritis with, but we have thousands
Mm-hmm.
of people with lupus nephritis. And everybody, we probably need to tweak their medications a little bit on the individual side. And if we
Okay.
can understand how your lupus nephritis differs from somebody else's lupus nephritis, maybe we treat you one way and the other person another way, and it's a lot better than just saying everybody's the same, let's just give everybody the same drug and see what happens. So
Wow, that's
those
so exciting.
those are some of the really exciting developments I think we're going to see in the not too distant future, frankly.
That is really exciting, and I'm so happy to hear. We say that all the time. We either say we're like snowflakes or like a fingerprint. And so the science is definitely showing and proving that to be true. Are there any other problems or issues that you've noticed in lupus nephritis patients that are kind of on the table to try to overcome as you are working through these new developments?
Well, I think that one thing that we do counsel our lupus patients on is that diet is important. One of the things that makes any kidney disease, it doesn't matter if it's lupus kidney disease or diabetic kidney disease, anything, if you can't control your if we can't help you control your blood pressure,
Yeah,
that really makes the kidney disease more rapidly progress
yeah.
in a bad direction. So one of the things we do is, we really need to form a partnership with the patient. I encourage all my patients, and I write prescriptions for blood pressure monitors all the time so they can check their blood pressure at
Mhm.
home. We have
That's
specific
good.
targets of blood pressure we want patients to achieve. But one of the things that's really important that patients can do for themselves is decrease their salt intake. I'm
Mm.
just going to say this, and people can yell at me, but most people with lupus are younger people, and they tend to have a younger person's diet. I was young
Mm-hmm.
once, and you know, some of that's fast food and pizza and all the good stuff that people like that's full of salt. and
Yeah.
and nothing, you know, if you have kidney disease and high blood pressure, it's really hard to control your blood pressure if you're taking in too much salt. And so
Yeah.
that's one thing we do talk to our lupus patients a lot about, is cutting their salt intake down. Now, I'm not saying you can't have a treat now and again. I mean, you know,
Mm-hmm.
I like pizza as much as anyone else, but a little bit of moderation would help go a long way. So that's something, you know, and that's not hard to do, but it's a little bit of a change. And, you know, people's diets are sort of ingrained in them. And, you know,
Mm-hmm.
once you get a diagnosis of lupus, you have enough to deal with, let alone thinking about taking out some of the fun things you eat. But a little bit of
Mm-hmm.
moderation is appropriate, I think.
Yeah, that's a good point. I will actually share. I don't think I had a horrible diet, but high blood pressure was a key indicator. In fact, that was like the biggest thing that was noticed when I was diagnosed, because
Mhm.
I was having an attack on my kidneys and my blood pressure was out of whack. And I think a lot of times people think that the blood pressure is around the heart, but the kidney plays a
No, big role.
in controlling that. So if the kidney's not okay, then your blood pressure is not going to be normal. Now, I hear something about ICER, ICER,
Yeah.
and I don't know a lot about it, but I want to get the scoop on what is ICER. So, and why is this important to the lupus nephritis community?
Yeah. So ICER is an organization that looks at the cost effectiveness of medications. And
Mm,
you know, one of the big issues that we all face as physicians is that we want to get good drugs out to our patients.
yeah,
And of course, unfortunately, a lot of medications are pretty expensive, as
right.
many of the folks on this conference will know, and the newer drugs are even more expensive. And
Yep.
ICER has been around. I don't know actually how long, but they've been around for a while, and so they do a economic analysis of the new medications when they come out, looking at their pricing, and then looking at their benefits, how the drug benefits the patient population. And
Oh,
they make, you know, this is fairly mathematical, but they in the end sort of make an assessment of whether the drug is cost effective for the community. And this is sort of important,
mm,
because, you know, we really want, and most patients need help with by insurance to help pay for the medications. And so we want
yes.
insurance companies to know that even though the medications are expensive, the benefit over time is really outweighs the cost. And so
Okay.
what ICER had evaluated both of the new drugs that were just approved for lupus nephritis just recently. I got to participate in this as a expert on the panel,
Okay.
along with another lupus physician, a rheumatologist, and patient
Okay.
representatives and insurance representatives and pharma manufacturers. It was a great discussion, and I
Okay.
think the most important thing that came out of that was that for both of these two new drugs, they
Mhm.
met ICER's threshold for being classified as cost-effective agents. So
Okay, that's
they
good to
got
hear.
they got a good grade, if you will, from
Okay.
ICER, which is very encouraging, because to me that should alleviate some of the concerns of insurance companies in terms of putting restrictions on our lupus medications.
Okay.
So to me, that was a really good conference and a really appropriate conclusion.
Okay. What does ICER actually stand for? And
I knew you were going to ask that, and I don't, you know, I'm a bit embarrassed. It's probably in my mind somewhere, but
yeah,
I don't know.
we'll remember ICER, but I understand. Is this from the recent report that they did?
Yeah,
Okay.
yeah. They just released a report, I think, literally 2 weeks ago.
Okay. So I know you're such a phenom when it comes to working with the lupus community. You have a great team and are really a pro at trying to find the right treatment plan for your patients. Are there other ways that we could promote good kidney health? I know you mentioned the diet, lowering your
Mhm.
salt, and
Mhm.
things that you do that you could share with the community to help people living with lupus nephritis.
Yeah, so a few things I think. First of all, I think patients need to be advocates for themselves. I think that's the most important thing. I see a lot of patients come in and they might have had kidney disease for a long time, but not that their doctor wasn't paying attention, but this is a complicated disease, and it
Yes, it
doesn't
is.
it doesn't necessarily present and say, I'm lupus, right? And and
Mm-hmm.
and so when you have signs or symptoms, you have to be persistent. And if someone can't figure out what's going on, then you need to sort of say, maybe I should see another physician. So that's number one. Number two,
Okay.
I do think that every patient with a diagnosis of lupus should have an evaluation of their kidneys at least once a year, so that
Okay.
once like I said, you can have blood in your urine but you don't see it. I see it under a
Okay.
microscope but you don't see it. You can
Okay.
have protein in your urine that's important and means something, but it doesn't show up as swelling yet. You
Mm-hmm.
can have damage to the kidney, and we measure kidney function through a blood test called creatinine, which I'm sure you're
Yes, I
familiar
pay
with,
attention to mine.
of course. So that's that should be those things should be checked every year, and I think it's important. If you're not getting that check, that you remind your primary care physician or your rheumatologist. Say, hey, how's my kidney doing? And make sure they check
Mm-hmm.
that, including looking at the urine or having the laboratory look at the urine. Because as I said, I think one of the things is, if we can get to patients quicker who have lupus
Mm-hmm.
nephritis, there are data that quicker therapy leads to better outcomes. And that makes sense, right?
Yeah. Yeah.
That makes sense. And then, again, I also think the lupus community in general has been really good about participating in clinical trials, but I want to emphasize what you said before, which is for us to continue to make these advances, we really do need the buy-in of the patients and their families, and
Mm-hmm.
we really do need this especially in communities of color,
Yeah.
because patients who are, for example, African ancestry, are overrepresented in the population of people who do badly or worse with lupus
Yeah.
nephritis, and they're really underrepresented in our clinical trials. And it's conceivable that responses may be different to different medications. You need different doses, you need different regimens, etc. Like I said, every
Yes, I'll admit that
individual.
that was the case for me. I needed actually more medication than standard when I was going through care for my lupus nephritis initially. So I saw this, and I do believe it is common in our community.
And so I think what we're trying to do is make sure that when we do trials and investigations in lupus, we broadly represent the people who are
Hmm.
afflicted by it,
Hmm.
and that's really key. And the other thing is, ask questions. And
Yeah.
if your doctor doesn't know because they're not a lupus expert, I'm going to shout out to the Lupus Foundation. I know they're sponsoring this conference, but I've not met many organizations where there's folks as hardworking as a Lupus Foundation, and they will go to extremes to answer your questions. In fact, sometimes patient questions are filtered to me. They say,
Mm.
"Hey, this patient sent in this question. What do you think?"
Yeah.
And I'm on their medical and scientific advisory council, and so it's
Hmm.
make sense. But use these organizations, and you're part of it. They're very patient
Mhm.
oriented, and the patients participate in all aspects of the organization. And I think that's really a way to get the importance of lupus out there. And then
Mhm.
I guess finally, talk to your families and don't be afraid to tell them what's going on,
Yeah.
right?
Yeah.
Because my take, since I've been doing, we've had a lupus clinic now for uh, over a decade, and
Wow,
really,
it's been that long. That's
yeah,
wonderful.
yeah, focused my practice, really focused on patients with lupus kidney disease, and I work with
Mm.
rheumatologists, so it's a whole lupus thing. But your family needs to go understand what you're going through so they can be supportive of you.
Right.
Um, because some days you're not going to feel well,
Mhm.
and your employer sort of has to know. I know people don't like to give their health histories to their employers, but
Right.
sometimes you don't want to come to work, right? It's just
Mhm.
you're having a bad day. And so if people understand what you're dealing with, I think it can make these sorts of things a little bit easier to have happen when it's necessary. So those are just some ideas I have. I mean, the lupus patient is the whole thing. You have to think about medication, you have to think about social, work life, family life,
Yeah.
everything, because it's really it's that pervasive of a disease process.
I definitely have to echo what you say, and I do feel like in a way I'm kind of a product of the Lupus Foundation of America and an example of how this organization really was the best piece I added to this journey to help me. I've been a volunteer for 15 years prior to
Mhm.
becoming a staff member. And I'm going to tell you, even though like a lot of things that we have right now, like the National Resource Center on Lupus wasn't available, but there was so much to help me understand this disease. And I feel like I've been a successful advocate. I feel like I'm thriving because of having people like you through the foundation and information education. And I do want to take a moment and encourage people. Number one, really talk to your family and think about being a part of these clinical trials because lupus nephritis is very difficult. It's almost like having two giants to battle when you're trying to become stable in this disease and manage everything. And it can be tough to manage, but also, not be silent about it. Like you said, talk to your family. I really believe everybody needs at least one person that's their advocate and on their side. And when you deal with lupus nephritis, it's a lot because you have to know a lot of numbers, like you were mentioning, and the management can be a little more challenging than just regular lupus symptoms. So, Dr. Rovin, I just have to thank you for all you've done for the community. I thank you for the work you've done. And I'm so glad you're celebrating a decade of work in lupus nephritis, and we can see the benefits in your efforts coming to fruition. So, thank
Thank you. It's been
you so
really
much.
my lupus patients are the best. They it's really fun to go to lupus clinic and see the people getting better. I really enjoy that a
Yeah,
lot. So I
yeah,
appreciate it. Thank you.
yes. Thank you.